We're going to talk about stroke today, and I have a couple of handouts when I'm done. I have a little refrigerator magnet that goes over the warning signs of stroke and what you should do. And I have a little pamphlet that goes over a lot of what I'm talking about, so you don't have to take any notes. A lot of it's going to be in here. And if you're really ambitious, I have a little scorecard that you can do, and it tells you your likelihood, your risk of having a stroke, and what you can do to lower that risk. So those are all by that table, so when we're done, don't forget. First, little history. Extra credit for anybody that can name those three gentlemen. Churchill, Roosevelt, and Stalin. Okay. This picture, they're really good, they're really sharp. This was taken in 1945. This is after World War II has ended. And these three gentlemen are deciding the fate of Europe. And if you look closely, Churchill is smoking a cigar. Roosevelt is smoking a cigarette. Didn't know cigarettes were bad for you then. So all three of those gentlemen smoked. All three of them had uncontrolled hypertension. There was no treatment for blood pressure. All three of them, believe it or not only had one stroke, but had multiple strokes at that time. And they were deciding the fate of Europe. Never would happen today, right? With the media the media would cover that up to the hilt, but this was common. President Eisenhower also had a stroke during his pregnancy that affected him, and that really brought awareness to stroke after that. And a lot of medical attention was put into stroke to see what we can do to prevent them from occurring. Stroke. What is it? Just the name sounds bad. Yeah, it can be a blockage. Simply put, it just means that you have a brain injury because you have a problem with the blood flow to the brain. So it could be a blockage from a blood clot, or it could be a blood vessel that bursts. But that's all it means. It's just, simply put, that's what it is. Here's some facts that kind of bring it to light. It's the third leading cause of death in the world. Number one is heart disease, and number two is cancer, lumping all the cancers together. And number three worldwide is stroke. In the United States, there's a stroke every 45 seconds. It's the most common cause of disability, permanent disability in the world. And it happens, men and women. Sometimes we don't always think of women having the problems that men have, but for women, we all know about breast cancer. Your risk of having a stroke is actually 3 times the risk of developing breast cancer. And it happens in all ages. At Roger C Peace, a couple of times every year, we actually have children that have had a stroke. So it can happen at any age. Obviously, it's not as common in the younger population, but we do see it, and fortunately, they recover. They recover very well. We live in the stroke belt, it's called, and that is the southeast United States. We have the highest rate of stroke, mainly because of what we eat. And we'll get into that a little bit later. So that's why it's even more important for us. South Carolina, we're number 8 in terms of the rate of stroke. So we're not number 1, but we're in the top 10. So it's very important. This is probably the most important thing I'm going to review is warning signs. And they're all going to be in those pamphlets I have in there, but it's very important to know the warning signs because when they occur, you have to go right to the emergency room, and I'll explain why that's so important. One of the most common is numbness or weakness. Usually it's on one half of your body. It could be the face, the arm, and the leg, or all of it. Often you'll notice somebody and their face is drooping. And to really bring it out, you can have them smile, and you'll see that only one half will smile. The other half doesn't move. Sometimes it's not so easy to see. You may notice your husband just shaves half his face. Wife only puts makeup on half of the face. These are signs, you know, that there is a stroke happening. If they can't move the arm and leg properly, that's a sign. And often the person isn't aware of it. So it's not a good idea to ask them, do you feel all right? Do you want to go to the hospital? Because they're going to say no. They're not going to have the insight that you have. So you don't want to give them that option. You want to say, you know what, something doesn't look right. I notice you're weak. Let's get in the car. We're going to the emergency room. Not going to the family doctor's office. That's just going to waste time. We're going to explain that in a minute. Your family doctor will see you and then tell you to go to the emergency room, and you've lost time. You've lost time. Another common one is just trouble speaking, the slurred speech. Can't find words sometimes, can't understand words. These are other signs that there's a stroke going on. As soon as you see that, emergency room. Go to the emergency room. Sometimes there's trouble seeing. Most commonly, the person feels like a shade is coming down. They feel like there's a shade coming down. It's very weird and very hard to describe. If you notice that, what do we do? Yes, emergency room. Sometimes there's trouble walking. Sometimes it just affects balance. So the person, their equilibrium may be off.
That's normal for senior citizens.
Even more than baseline. You're right. But these are usually fairly dramatic. You know, not like you are every day. Something has really changed. And the last one is severe headache. Now, we've all probably experienced headaches, but this is a special headache. A headache, worst headache you've ever had. And it doesn't seem like any other headache that you've had. You don't want to wait for it to go away. You want to immediately go to the emergency room. And now we're going to talk about why that's so important. Just like when you have chest pain, you have to go to the emergency room because you may be having a heart attack. With a stroke, there's a 3-hour window to treat. And this is relatively new. So as soon as the symptoms start, the doctor has about 3 hours to do testing and then treat. If you wait more than 3 hours, then you've lost that opportunity to get treatment. What needs to be done first is what we call a CT scan of the brain. And strokes fall into two categories. Most of them, 80%, are what we call ischemic, and they're caused by a clot. And then 20% are what we call hemorrhage, and that's from bleeding. The ones in this category, the majority, we can give a medicine called TPA, and it will dissolve the clot. And in many cases, it will reverse the process completely. But if we wait longer than 3 hours, we can't do that because it will increase the risk of bleeding. So does everybody see the importance of why? Because we can't tell by symptoms what's going on. We have to do the CT scan, and then that will tell us what kind of stroke we're having. Even if this is going on, though, we can do a lot of good. We can control blood pressure. We can do things to limit this from causing more damage. I'm going to show you a CT scan, and it's not showing up as well as I thought, but oh, that one's a little darker, yeah. If you look, this is what this blood on a CT scan looks white. So this is a hemorrhage here with the orange star. This is the open. We all have a hole in our brain, and that's normal. This dark spot. So And it depends on what slice you take. Sometimes it looks larger, sometimes it looks smaller, but this is normal, so there's a little empty space in everybody's brain. Some more than others. And this side shows where there's a clot. You see there's like a light gray and then it's a darker look. So it looks completely different when there's a blood clot. Usually it's just on one side, but this is a picture of both. So if we saw this, we would give the TPA. And most of the strokes would look like this. And if they look like that, we wouldn't want to do that. We wouldn't want to do that. So if you go to your doctor's office, see, they don't have the CT scan. So they can't do the first step. Now let's talk about risk factors. And most of you may know about these risk factors, but there's a guy in a suit jumping across 2 rocks. Probably not many of us would want to do that over and over again, because eventually you're going to fall, right? So it's the same thing with these risk factors. If you go every day without addressing them, you know one day something probably going to happen. The most important risk factor is hypertension or high blood pressure. And since we've started treating high blood pressure more effectively, the rate of stroke has gone way down compared to what it used to be. Now in the United States, we don't do as good a job as we would really like. 1/3 of the people with high blood pressure don't even know they have it, because it often doesn't cause any symptoms. Unless you're getting checked, you may not be aware of it. Another 1/3 know they have high blood pressure, but it's not controlled very well. Sometimes they're put on medicine and it doesn't agree with them, or they can't afford the medicine, or there's some issue. And then only 1/3 actually have it well controlled. So I guess my message would be, you want to know if you have this and you don't want to give up. There's probably over 50 medicines for high blood pressure. So you want to try to take one. If it causes a bad side effect, just talk to your doctor. This isn't agreeing with me. Be patient. Go on to the next one. You know, or sometimes you have to have more than one at a lower dose. But don't give up. Keep trying until you get it under control. If the medicine's too expensive, there's cheaper ones. Have them get creative. They are less expensive. But don't give up. Keep going until you got it controlled. Most important thing you can do. The other thing that helps all of these risk factors is just, it's no secret, just eating well and exercising and trying to be your ideal weight will do a lot towards all of these risk factors. The next one is diabetes. Diabetes increases your risk of stroke by 2, it doubles it. So this is a condition that requires a lot of attention by going to the doctor regularly. And again, that is helped by good nutrition, and exercise will help that condition. Heart disease, coronary artery disease doubles your risk of stroke. If the vessels in the heart are not in the best shape, usually the vessels in other places of the body are not in the best shape. These are 2 special cases. Atrial fibrillation. You may have a healthy heart, but atrial fibrillation, the electrical pattern in the heart is not quite right. Again, you may not have a lot of symptoms with this, but that increases your rate of stroke by 5 times because you tend to form a clot in your heart and it travels. Fortunately, you can be put on a medicine called Coumadin and it will eliminate that risk. You just have to know if this is what's going on. And the same thing with heart valve disease. If you have a heart valve that's not working properly, you can form a blood clot and it can break off and travel to the brain and cause a stroke. And both of these conditions raise the risk of stroke by 5 times, which is a lot. But with the Coumadin, a pill, it lowers it dramatically. Coumadin's tough because you got to get blood checked a lot to really regulate it. I don't know if anybody in here has had Coumadin before or been aware of it. But they're coming up with a new medicine that we're just starting to use where you don't have to get blood work. So that may be a big advantage if it does the same thing without having to worrying about what you eat and how you check it and all those things. So it may improve compliance a lot. High cholesterol is another one that can raise the risk of stroke. Interestingly, what we found is there's medicines for cholesterol. A lot of us, just genetically, our cholesterol is high no matter what we do. And what we found is that after someone has a stroke, we found that even if their cholesterol is normal, if we put them on a medicine for cholesterol, it will lower their risk of having another one. So it's very routine after a stroke to have someone put on medicine for cholesterol no matter what their level of cholesterol is. Smoking. Don't take after Winston Churchill and Franklin Roosevelt. Don't smoke. It's bad. Smoking raises the risk of stroke very dramatically. In fact, we usually tell folks that have had a stroke, if you continue to smoke, you'll have another one. No matter what we do medically, you'll probably have another one. Now, what can we do? And I'm going to talk a little bit about nutrition, and we're going to have some fun slides in a minute. But nutrition can take you a long way towards not only reducing stroke, but helping high blood pressure, helping diabetes, lowering cholesterol. And this is a good meal that you're having here, a salad with some chicken. That's a very healthy meal. And the cheesecake.
I didn't eat mine.
Sue, the cheesecake. Andrew, the cheesecake. No, I heard some of you were at the Y, though. Who was at the Y? So you can have a cheesecake because you exercise is very forgiving to what you eat. You know, if you exercise, you can eat your cheesecake. But we have a lot of options in the United States. When you go to a supermarket, we have tons of options, and that's almost a bad thing, you know, because we don't always make good choices. And a lot of countries that are less, and we're going to look at that in a minute, they don't have a lot of, in fact, all they can eat is healthy stuff. Believe it or not, we are 36th in the world in terms of how long people live in the United States. So there's 35 countries where people live longer than the United States, even though we have the most modern medical care. We can do procedures that aren't done anywhere else. And that's mainly because of nutrition, unfortunately, that we don't eat as well as we should. And what I try to tell my patients is if you're not eating the best, maybe focus on one meal. Maybe just focus on breakfast, for example. Just focus, I'm going to do good with one meal. I'm going to eat a high fiber cereal with a glass of orange juice, maybe a little fruit, and I'm going to just do that. And that's actually makes a difference. And if you get real ambitious, maybe you'll do it 2 meals out of the day. And that does have an impact on us. Now what I'm going to do is I'm going to show some slides, and they're going to show different parts of the world. They're going to show a family, typical family in different countries. And on their kitchen table is their entire food supply for the week. Okay? And how much it costs. And it's going to be very typical for the region. And we're not going to make any judgments. We're just going to look, see what they're eating. Maybe look at how much they're eating, how much fruits and vegetables. And look at do they look healthy. And I think you're going to see most of them, except for the very last slide, most of them are going to look well fed. They're going to look pretty good. No, we're going to show America first. Okay. So I don't know if we can turn these down. It might be better. Can you guys see that? I'm right up next to it. So yeah, I'm right next to it, so it looks like, yeah, that's better, right? That better?
Oh my God.
Now this is the Revis family from North Carolina, and don't make fun of them. This is very typical of what people eat. Every case. So that's it. Okay, no judgment, just looking. They cost $342. Okay, for 1 week for all that stuff. Okay. Okay, now we're going to move to Italy. We're going to kind of go down. Italy, $260. They're spending less money. A lot of bread. That jumps out at you.
Yeah, but it's so good that way.
They look pretty well fed. Doesn't this guy look? He looks pretty good. So that's what they're eating in what we would call Western Europe, which is a little bit more wealthy than Eastern Europe. It seems like soda's in every one, almost. So we'll go down to neighbors to the south, Casales family in Mexico, and you'll see the cost per week it goes down, keeps going down, $189. And this is what they consume.
Oh my God, I didn't see it. The Coke.
The Coke? Yeah, they like their Coke. But there's a lot of veggies though too. A lot of veggies. You're going to see less processed food. Okay, processed food is not good. You see less processed food. Now we go to Poland, Eastern Europe. It's not as wealthy, and you can see $151 per week is spent. And you got to peek around. They got stuff kind of stashed around. But you see it's a colder climate, but you see, you'll see veggies and stuff that grows in the
Is that U.S. dollars? Or that
U.S. dollars, U.S. dollars,
Things are expensive.
U.S. dollars, U.S. dollars, U.S. dollars.
So they have 5 adults in that family.
Yeah, the amount of people will differ, but don't focus too much on that. But yeah, there's not a lot of difference. You'll see some families bigger, some families smaller. Okay, now we're going to start going into less fortunate areas of the world. This is Egypt. Okay, $69 per week, and
look at how many people. No Coke. Wow.
yeah, there's no Coke. Maybe is this? There's something over there. I don't know what it is. Oh yeah. There's only one bottle though for the whole family all week. So that's a little different. But they look pretty good. Would you agree? They don't look like they're not. Yeah, they're not starving. They're not starving. Okay. Now we're gonna go. Rougher places. This is Ecuador, and I've traveled here personally, and it's in the Andes. And this is not in the city. This is very rural. So you're in an area now. You don't have electricity. Now you don't have indoor plumbing. You're just farmers. And there's definitely no processed food at all. And you don't spend a lot on food because you're growing most of it. It's only $32 per week, U.S. dollars. And they're pretty healthy, actually. And their diet is pretty healthy. They have a grain called quinoa, which is probably the most healthy grain that there is. And so their diet is actually, it doesn't have the variety we would want to deal with, but, but these are just examples. And next, this is Bhutan. Bhutan is a country just south of Tibet. It's in the Himalayas, very remote. Very remote. And that's a lot of people. Now they got a big bag of rice over here, so I think they're living off that mostly. And there's not. There's a lot of, they're just supplementing it with a little bit of stuff. Now I'll tell you, I've been to this country, and they love their cookies. So I don't think they're showing the cookies. They like their cookies. I'm just saying.
How about eggs or something like this? Protein.
Yeah, but I tell you, there's not. They seem to eat less meat, more vegetables as you go down, and there's only $5. Now the last one is extreme. Okay, it's a refugee camp, but just telling you extreme. Okay. And this is Chad, and this is in Africa currently. And so this is a refugee camp, okay? And unfortunately, believe it or not, nutritionally, because of the circumstances, the difficulties, they just get enough to keep their nutrition. And so you've got some peas, you got some rice, you got beans, and there's not else a lot with it. And it's not optimal for sure. It's not something anybody would recommend, but it's enough to keep your nutrition. And it's only, believe it or not, $1.23 for a whole week. So the, pardon?
No meat.
No, doesn't look like it. I don't know.
Did they grow those those?
No, these are provided. This is in a camp,
Right, okay.
and this is United Nations, and this is physicians. We only got so much budget. We only got, how can we keep people going with the food that's the cheapest that's in the area? Does that make sense? Yeah,
Are
yeah.
they healthy?
Probably not.
They're not. They're getting by. You know, they're getting by. They're not having any nutritional deficits in terms of vitamin deficiencies and stuff like that. But it's, you're not going to gain any weight, that's for sure. You know, but there's a lot of, those environments usually have a lot of people. Yeah, a lot of people. But the point is, you know, we got all these options, right? And I remember when I was a little boy, I didn't like school. My father said, well, you're going to go to school for 12 years at least, so you might as well do good. So if you got to eat, you might as well try to eat healthy, you know. If you're careful, it won't cost you much more, and you got to take the time to eat every day. And you don't want to be too crazy about it. We all have to have our desserts and things that we enjoy, but if you could just concentrate on a meal or two, eating better. How much more? Good, good, okay. Now I'll speed up because of the time. I'm getting carried away on nutrition. So we'll go through exercise quick. Exercise is important, and it doesn't take much. Just 20 minutes, 3 times a week, believe it or not, is enough to make a difference. If you do more than that, that's even better. But that's only an hour in a whole week. Where's the best parking space? Pardon? Farthest away. Yeah, no car's going to hit you when they open the door, and you get exercise walking in, you know. So I actually do that. Drives my wife a little batty, but I just, you know, I park far away, and I just say, hey, I'm walking, I'm exercising, I'm, you know, getting that in. So if you eat better and exercise, that's going to help you. You know, I always tell my nurses, they see me eating right, or they see me, I say I'm in training. Okay? So that's what you should do. You should, when you're eating right or something, just say, or maybe you know, someone offers you a cheesecake and you say, not today, say, I'm in training. And then they're going to say, what are they going to say? They're going to say, what for? Right?
Marathon.
No. You say, for what's next. And they're going to say, well, what's next? And you're going to say, I don't know. That's the point. Right? We have to train because we don't know if we're going to have a stroke. We don't know if we're getting in a car accident. We don't know what life's going to throw us. But if we're healthier, we'll do a lot better. I see that every day in the hospital. You know, you'll see people that are healthier overall. They just recover a lot better than folks that are not. Now we'll go real quick with recovery, rehabilitation. I'll try to wrap up in about 5 minutes. Let's say someone has had a stroke. Well, what happens? We have some spontaneous recovery. That means we have recovery no matter what we do. You know, doctor doesn't have to be there. There's just a recovery that just happens. And then we have a component called adaptation, and that's where the rehabilitation, maybe you don't get recovery, but they teach you how to overcome it. For example, if your leg is weak, when you go upstairs, you're going to go up with the good leg, and you're going to go down with the bad leg. Little tricks like that. Up with the good leg, you're going to heaven, right? Down with the bad, you know. So, you know, that's adaptation, learning how to deal with. And then there's relearning. And that's what also rehabilitation impacts. And that's teaching parts of the brain that are still healthy to kind of take over. And we're getting better and better at that. Most of the recovery from a stroke will happen in the first 3 months, but it can go on a year or two. Okay, it can go on a year or two. And that's just a picture of a patient that's had a stroke learning how to walk. I guess it'll be my little brief commercial. That when you have a stroke, Some people have a very mild stroke. They're evaluated in the hospital, but they can still do most things for themselves. They're able to go home. Often just home health therapy or outpatient therapy will do the trick. Other folks, the stroke is more advanced, and if a person, let's say the opposite, let's say they're frail beforehand with a lot of medical problems and they just have a devastating stroke where they're not going to recover, then they may have to go to a skilled nursing facility, which have come a long way in the therapies that they offer. But most people will be in between, and that's where you need to go to the Rehabilitation Hospital, because we found that if you get intense therapy in the beginning, it will impact your ultimate recovery at the end. And sometimes you have to fight for that a little bit. I can tell you that about a year or two ago, if someone had a stroke and I wanted to bring them to the rehab hospital and they're on Medicare, no problem. But in the last year, some of the managed companies that manage Medicare, they question it. And they give sometimes they give a little hard time of it. So sometimes it almost comes to the patient's family making a call and making them back down, because that's your chance to get better.